Good afternoon, everyone. Thank you for having me. For those that have not met me, my name is Kenna Foster. I am the Putnam County School District Health Services Coordinator. I'm a registered nurse with over 30 years experience in emergency medicine, critical care, public health, epidemiology, and forensics. So today, I'd like to review with you how we're framing a safe school year with COVID-19 and the Delta variant. So COVID-19, where are we? Which one? This one? Okay. So in the state of Florida, currently, we've had a 34% new daily reported case rate decrease in the past 14 days. We've had a 3-week consecutive decline in positivity rates and a 2-week consecutive decline in pediatric case rates. In Putnam County, we had a 2-week decline in positivity rates. However, this past week, we did increase 2% and have a current positivity rate of 27.4%. Our vaccination rate is at 48%. Currently, the Putnam County School District, and this data was as of this morning, we have 31 students isolated with positive results, 27 employees isolated with positive results, 141 students quarantined as a result of school setting exposure, and 0 employees quarantined as a result of school setting exposure. The numbers on the dashboard do not reflect charter schools. It is pre-K through 12, and it does not reflect home tests. These are tests only reported to Florida Department of Health.
Kenna, can I ask real quickly, is that for the week or since the beginning of school?
The dashboard is meant to show the community as of today, September 7th, how many people will not report to work or school September 7th.
Just for the day?
Just for today. Because I believe the numbers should be shown to show you what's happening today in the district,
Okay.
not the growing number or decreasing number, because there's data for that elsewhere.
I got a question. So that 141
I don't
is
know if
actually what's going on right now today? That's quarantine related to school setting exposure?
Polly, let's hear the presentation.
Can we
and then-
have the
I wanna
complete,
understand. I wanna understand.
Yeah,
Okay.
we do too, but we have a time for that.
right,
Oh, okay, well, I'm sorry.
okay, so we'll just continue
I'll
with
just
the
not ask my
presentation.
questions till the end, Kenna.
Okay. And at the end of my presentation, I will open it up for questions, because it is important to me that you understand. Okay. So our protocols for controlling COVID-19 this year are pause is the first thing. Be surgical, not sweeping. Quickly assess and limit the impact. Stay home if you feel sick or see symptoms of sickness. Stay home or go home. 3, clean. Schools should encourage routine cleaning of classrooms and high-traffic area. 4, wash. Students should continue to be encouraged to wash their hands through the day. Currently, the symptoms of COVID-19, I'd like to review those, because in the beginning of COVID-19, we were told cough, fever, shortness of breath. Then as summer 2020 rolled around, we started seeing, hey, loss of taste, loss of smell. You got that, you've got COVID, don't worry about anything else. Delta variant brought a new classic presentation. You're seeing sore throat, congestion, runny nose, fever, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle aches, headache, loss of taste, loss of smell, nausea, vomiting, and diarrhea. That's what makes COVID so difficult to control in the community and why you have the pandemic. You are contagious 2 days before you show a symptom. So you are with your family at a barbecue, you are in a grocery store, you're at work, you're feeling fine, you're going out to lunch with your peers, and you are contagious. And then when we roll into the season where people come back to work, teachers, they're talking a lot, might get a sore throat, people have allergies in the fall, and it's easy to dismiss those symptoms as COVID because you're quick to say, oh, it's my allergies, or oh, because I'm talking, or oh, I joined the gym and I went and worked out really hard yesterday. So it's important if you have one symptom, you stay home or go home. Okay. Prevention strategies. Individuals ask, what are we doing in Putnam County School District to prevent the spread of COVID-19? One, we promote vaccinations. We've had numerous on-school campus vaccination clinics in partnership with Florida Health Heroes and Florida Department of Health to offer employees and students vaccinations. We highly recommend consistent and correct mask use. Please remember, if Ms. Gilliard has on a mask, Ms. Gilliard is protecting you from getting her COVID if she has COVID. Okay? Ms. Crawford down there having on a mask is not protected because she has on a mask. It is the wearer who is protecting the community. The only difference is if you have on an N95, which is the medical mask, then you are protected from getting whatever virus or disease is there. A mask must be double layered, washable material, well-fitting, cover your nose and your mouth, have a metal piece above here that you can pinch with your nose. It can't have a vent where you're exhaling out. It can't be a gaiter because that's not double layered. It can't be a shield. And even if individuals do all of that, if it's not worn correctly and it's seeping out, remember that COVID-19 is also passed through your eyes and your mucous membranes. So if you don't have on goggles, you can still pass it through your eyes. So I know that masks are a concern, and I thought all weekend long, how can I best put this? No matter what position you have regarding a mask, you can find a study to back that up. There are some studies that say a cloth mask only protects you for 27 minutes. There are some studies that say now COVID is aerosol, so a mask is not going to help unless you have on an N95. There are some studies that say masks help, but they have not removed the other mitigation factors in those studies. And what I mean is when they studied, they still studied with social distancing and good ventilation. They just didn't put people in a room together with a mask. So as a district, when I am making recommendations to executive leadership and the board, I look at what consistently we follow. Our board policy states that when it comes to communicable disease, we will follow the recommendations of the Florida Department of Health. The Florida Department of Health is the statutory government agency that is responsible for communicable disease. Whether that be the guidelines we're going to follow as a community, contact tracing, reporting, quarantine, isolation. That is Florida Department of Health. And so right now, Florida Department of Health states masks are optional. And that is the position that we have at this moment, based off of our board policy and their position. So we are encouraging hand washing, respiratory etiquette, which is cough and cover, physical distancing, which the guidelines say, please practice 3 feet if at all possible in a school setting, okay? Stay home when you're sick and get tested. Cleaning and disinfection, ventilation. We have a dedicated triage assistant in every school. And when a student goes to those schools, they complete a log. And then I review every one of those logs and every student that goes through that triage room daily. We have seating charts for classrooms, some cafeterias and buses. I have access to sports rosters where they line up in the locker room. I consult with principals and executive leadership on school events. We have limited visitors on campus. We've amended procedures for student arrival and dismissal. We transitioned to virtual employee meetings when possible. We've limited district staff who visit numerous schools when possible. We are unique, one of the few districts in the state that have surveillance, contact tracing, and case management 7 days a week. My team does not take off. We are available 7 days a week, and we offer employee case management. My number is available for employees, and I have informed executive leadership to let their team know I'm available 6 a.m. to 10 p.m. for employees. And they do take the opportunity to call with questions. Where can they test? What type of home test could they take? Where could they go get antibodies? And I help research all that and connect them with those resources. So I'd like to share with you the decision tree. This is the 2021-2022 school year. You'll see at the top, the pause, stay, clean, and wash. So we are going to start with exposed to a COVID-19 positive case, okay? If you have no symptoms, you can return to school after you have tested negative on day 5. So you have to complete 4 full days of quarantine. Day 5, you can take a test. It cannot be a home test. It has to be a test that's going to be reported to the Florida Department of Health. Currently, there is one. And this is not the district's rules in regards to home tests. The FDA issued emergency authorization use for certain home tests. The majority of home tests, except one, you have to have symptoms for it to be considered valid. So if we're saying you can have no symptoms, that's why you can't take the home test, because you've got to be no symptoms, okay? If you choose not to do that option with the test, then a student can return on day 8 after their last exposure. So they will quarantine for 7 full days and return for day 8. Well, how do people know that? If they've been in contact with the Florida Department of Health, the Florida Department of Health will relay that to them. Also, I have a document which I communicate with each principal, which student is on isolation, which student is on quarantine. It has special codes, so they don't know why that student is out. They just know the student is out. This is the day they're excluded. This is the day they return. And that is updated in live time throughout the day, and they call if they have questions.
Did they call the school or?
The school calls me.
Okay.
There are some individuals that call me, some email me, and we communicate that way. So if you're exposed to a case of COVID-19 and you have symptoms, then you automatically drop down into the next category, okay? So I'm a contact to a case. I have no symptoms. I have 2 choices. Test on day 5. When it is negative and I still have no symptoms, I can come back to school. If I choose not to test on day 8, if I have no symptoms, I come back to school. Okay. All right. A person who has COVID-19 symptoms or they are positive for COVID-19, they have 3 choices to come back. 1, a physician note and no symptoms. 2, the student receives a negative test and has no symptoms. 3, the student is out for 10 days past their symptom onset. They are fever-free for 24 hours, and they have improved symptoms. So there is no longer the you must be out 14 days or you must be out 10 days. And I'm sorry, Ms. Gilliard, it's because you're sitting here. So if Ms. Gilliard tests positive today, she tested because she was a contact to someone. She has no symptoms. I'm going to talk to her and I'm going to say, well, in about 5 days, if you have no symptoms, go get another test. If she then is negative, then she could come back only after 5 days of isolation. Okay. That is a change from last year. So oftentimes you are seeing people that are quarantined or contacts come back before the person that actually exposed them, which is a reverse from last year. Students with prior COVID-19 infection in the past 90 days, so you've had COVID in the past 3 months, or you're vaccinated, if you are no symptoms, you can return back to school. Okay, if you have symptoms, then you go back up to section 2 and you go through that. Okay, all right. So we are in, everybody knows that COVID-19 has been a very fluid situation from the beginning. It is ever changing and causes us to be flexible, which causes confusion at times, frustration at times. So we now have 2 types of tests. We have a home test, which you can take, which is not reported to the Florida Department of Health unless it is that specific test that you download an app. It gives you a printout and it's reported. We're talking just your regular home test. So I'm going to cover first the protocol for cases reported by the Florida Department of Health and how the process works. So the district is notified of a confirmed case. So this case has been reported to the Florida Department of Health. At that point, we begin contact tracing on behalf of the health department. Remember, they own the statutory responsibility. We are doing this on their behalf. So through interviews and contact tracing, I determine which students should be excluded or quarantined if necessary. I then, depending on the hour, sometimes send the letter to the schools, and the schools issue it to the students and call the parents. If the school has closed or it's on the weekend or Christmas or Labor Day, whatever it might be, then I do a robocall to the parent. I email the FDOH quarantine letter, and I send the decision tree. I then send the report to the principals with a copy of the letter so they have a reference. The positive student will isolate and returns to school per the decision tree. So that is cases that are confirmed by the Florida Department of Health. This is a sample of what the letter looks like. It's very clear to the reader. This is the date you were exposed. This is day 5 that you could test. This is day 8 you could return. Here are the steps you can use to prevent it, and here are the things you need to look out for. Again, we issue that on behalf of the Florida Department of Health, and then I send that information to the Florida Department of Health for their records. Okay. Then we have a protocol for cases that are reported by families with at-home testing. So the district is notified of the positive result of an at-home test. We encourage the parent to contact their physician, get a send-off PCR test, but if that's not feasible or they choose not to, then we continue down the road of identifying the possible exposures through contact tracing. We cannot quarantine or exclude these students. This is not a reported case, and as you remember I said, we issue the quarantine letter on behalf of the health department. If you call the health department, this case does not exist. We heard the concerns from parents and from employees. Hey, there was a case in my class, and maybe they didn't know it was a home test or all the rules that go with this. So I work closely with executive leadership and Ashley, and we developed a letter now that we began using Friday. So for students that are a contact to a case that was tested at home, there is now an informational letter that will be given to those students. The students cannot be quarantined. However, the parents should look at the letter and the decision tree to make a decision for their families. The positive student still needs to isolate because they're symptomatic and return per the decision tree. And this is the letter that was developed in response to the concerns we received. And that we began using on Friday. It lets the parents know they may have been a contact. It lets them know what COVID-19 is, what are the symptoms they should look for, what is considered a close contact. Okay, so that is, and then it asks, they can always contact me with questions regarding that. So news, great things coming. I received word today from the Florida Department of Health that the contract that the board, the MOU, the board signed, will go into effect on Friday, and the testing site at Hudson Avenue will now offer testing Tuesday through Saturday from 9 a.m. to 5 p.m. That will be of great benefit, so people will not have to go purchase the home test, will not have to scramble to find a test. In addition, we have developed a COVID-19 webpage with a daily dashboard, frequently asked questions, links to relevant resources, and other important updates. And I also learned today that Tallahassee would be sending the district rapid test kits. So coming soon, we will be able to offer rapid testing with apparent consent at schools for symptomatic students. So all of these things, when people say, what are you doing to control COVID-19? These are the many layers that we have. We are fortunate that we can contact trace on Labor Day, that we can contact trace on Tuesday and not wait until business hours open back up 4 days later to begin. Because by that time, they've been out for the weekend, they've spread it further in the community. No system is perfect, nor do I claim that we are perfect. I know there have been concerns. I've called, you've not returned my call within a certain period of time. At this time, my focus is on contact tracing and making sure that our schools are safe. I do have an assistant that began 2 weeks ago. She is now responding to phone calls, and we are also training triage techs at schools to respond. But I think that with the new website we have, explaining the decision tree will all work to our benefit. Okay, I will take questions now at this time.
The decision tree is on our website. Okay.
Yes,
Yeah.
I read it on the website.
We are gonna make this aspect of the video available on our website, right, Ashley?
Correct.
So, people can pull that up at any time and hear the presentation.
Ms. Foster, I can't thank you enough for what you've done. Thank you so much.
Kenna, you answered every question I had written down, but I want to ask you this. Are you having to do the contract tracing by yourself for this entire district?
I have a lot of help. And what I mean by that is there is probably not a principal or a coach I don't talk to daily. When I say, hey, I'm in the midst of this, can you have a secretary pull the seating charts? The teachers have been phenomenal in getting seating charts up, and I'm training my assistant. However, I have one big character flaw of trying to manage. I know how important this is, so I'm delegating things to her, but teaching people along the way.
Yeah. Well, I couldn't imagine how you could do that by yourself.
The seating charts help immensely, and having the student rosters, the sporting rosters, being able to call the coach or the teacher. I've started calling teachers and say, hey, I'm looking at your seating chart, but tell me what happened that day. Mm-hmm. What did you do? And they're like, well, the seating chart's this, but we had rug time, or we did pottery, or whatever it might be. And then that changes the dynamic of what's happening.
So in the cases where an entire class has had to go home and isolate, how do you make that decision?
To date, we have not reported this school year an outbreak or a cluster to the health department. However, in looking at what you might consider an outbreak situation is when 2 or more individuals in a classroom are positive, or 1 is positive and 2 have symptoms within a certain time frame that you can only link to that classroom, then that would be an outbreak. We've not had that. It's hard to do that at this point because the community rate is high. So I step back and look at, did this kid have a fever? Did this kid cough? Is the teacher telling me that they had rug time? Is it a pre-K class where they're not maintaining what they should? And then at that point, I talk with the principal and say, I think it's in our best interest to do this. So for the couple classes we've sent home, that's been why.
Okay.
A lot have been pre-K classes. Some have been a couple of cases, although they were not linked or even sitting near each other in the classroom. I felt it prudent to stop it before the spread.
Okay, Mrs., oh, go ahead.
Yeah, I just want to show you guys, we went live with this today, tried to put it in a place that would be a little more user-friendly
Oh,
to
good,
our
'cause I had to
families.
dig around for it.
It can be found under menu, under quick links, you can find it there.
That's where I go.
Or you can find it across, this is called our gallery on our
That's where
website.
I
It can be found there as well. So when you click here, you'll see the dashboard has been moved to one site. Nothing's changed with that. Below the, also, I do want to include here, we've had some questions around the change in this total numbers up here. And we had to correct some of our numbering to ensure that the numbers here are reflected in this data. So where we don't include charter school data in our dashboard, these total number of students does not include charter. It does, however, include pre-K. BPK and pre-K ESC are included in that number.
Nor do we do tracing for the charter, the Florida Department of Health.
That's pre-K to 12.
Yes, ma'am. So under this, you will see a, what we did was try to look at some of the questions I've been getting by phone and things Kenna has gotten in our principals. We also looked at surrounding districts to see if there were questions out there, just to be sure there's not things people have questions about they just haven't had time to ask. So any question you have regarding, you know, what do I do if my child tests positive? What happens if I got this kind of letter? All the way down to some of the questions we're getting now. What, my child does not have access to a computer at home to complete schoolwork. What can I do? So we are going to continue to add these. So each day as we get questions, I'll get with Kenna and I'll update them. So they will change regularly as we get new questions. If I have to change the answer to a question, so let's say Department of Health comes back and says, this is our new protocol, we'll update that there as well.
So if a parent can't get Mrs. Foster, they can get
They
you.
can always get me
And
correct.
they
So
can
when
email
call-
you,
They can
uh,
call the main school district number. I sit behind the front desk, and I'll answer any community questions. And if I can't answer it, I call Kenna directly and we figure it out, sometimes at midnight. So,
What
also-
about high-risk students? Because they do exist in our district, what measures are specifically being taken to protect them?
That would be, I'm gonna answer on behalf of the district for that one and say we take the same measures for a high-risk student as we do any other student. And certainly, all of our families, whether they're high-risk families or students of students who are not considered high-risk, had the option for digital learning through Putnam Virtual School at the beginning of the year. So we tried our best to inform families so they could make those types of decisions before school started, as the pandemic was pretty widespread right before school started. So we gave students, I believe they had a week after school started. We still were
did.
enrolling students for Putnam Virtual, trying to get as many of those families in who had concerns.
And so they would have been taking advantage of it, or have taken.
We've had a lot take advantage of that, yes, ma'am. Health and safety documents are here. That's where you'll find the decision tree. And we have that in both English and Spanish. This is a document from the Florida Department of Education, by the way, and they did that along with Department of Health. And then under resources are just local resources that might be helpful. We have a lot of folks call and ask about testing vaccination information. So this links to the Putnam County Department of Health website. And if you click right here in the middle, you can see any kind of updates they have regarding testing locations, vaccination sites. We get that question a lot. On top of CVS, Walgreens, and other places offering vaccines, the Putnam County Health Department has been offering it 9 to 3 every day. So we do try to encourage families there if that's something they're interested in.
And for the families that don't have access to this, you've already told
We do
them
them
that
by
they
phone.
could call
They can
you.
call us,
Give that number.
Alice and Tracy at the front desk have this information and share frequently, and I do as well. So,
Give the phone number.
yeah,
'Cause
sure.
it's
It's
being
386-329-0538 is our school district main line.
Okay.
So that is available. If there are, we ask community if there are things that you wish you could see on that are not there, to please let us know. Felicia and I will update as much as possible.
Okay, and this one, when we talked earlier, excuse me, you said it was possibly a Mr. Boland question. Why have sanitation procedures become so lax, given our current local positivity rate? And what efforts are being made on the part of the Putnam County School District to implement with integrity to ensure that protocol is being followed in reality on a day-to-day basis, and who's supervising or checking this? Mr. Boland, when I met with them, they said that would be one that you could answer so that parents will hear it from you.
While he's coming up, Madam Chair, I know we have some public comments that will probably be asking questions. I'm gonna ask Kenna if she would remain in the audience, and then if y'all need to, if you need to call on Kenna to answer the question or whatever you deem appropriate, I'd rather them speak to the
This is
board
the one
and not directly to Kenna.
Okay,
Okay.
all right.
Yes, sir.
In the schools?
Yeah, what you did last year and how you, what are you doing now? Yes, sir.
Right, so what we found last year was that the type of cleaning that went on last year should be the type of cleaning that goes on all the time. And in many cases, we found that our local custodial staff did most of the heavy lifting. The money to allocate just a specific person to walk around cleaning doorknobs isn't there this year in the schools. That allocation is present at transportation for the buses, and we're still trying to locate at least 2 more individuals for that. In the meantime, the bus drivers have been asked to do that. But at the school level, the expectation is that the deep cleaning is still occurring. So if that isn't happening, and I think it also was mentioned or asked who should be supervising that, and that should be supervised at the local building level. So at a school, the principal would be in charge of that. At a district building, who's ever in charge at that district building will be in charge of that. But I'm available to answer any questions or field any complaints along those lines. So if you have any, call the district number and let me know where they are, and I'll certainly look into it.
Thank you,
Thank
Mr.
you,
Boland.
Thomas.
Thank you so much. And thank you.
Any other questions from the board before I sit?
You took
That
care
was
of
a
it.
wonderful presentation.
You
Yes,
took care
it
of it.
was, and I will say that anytime I've emailed Kenna, she immediately gets right back to me. It doesn't matter what time of day it is.
Or a
and,
phone call.
she's amazing, the amount of work she's done.
Yep.